Mary Ann Flotty was a loving mother and grandmother.
My mom was the kind of mom the whole world needs. She was very loving, and she did everything she could for us and for her friends.
Before she died, Mary Ann spent 15 days in the ICU after a serious autoimmune disease affected her lungs.
The actions were a little of hope of trying things, but it seemed contradictory with seeing her on a ventilator.
Mary Ann's daughter was one of her surrogate decision makers.
We set out to understand how often physicians and surrogates in ICUs have different expectations about the patient's prognosis.
Dr. Douglas White from the University of Pittsburgh Medical Center and co-authors enrolled 99 physicians and 229 surrogates who made decisions for 174 critically ill patients in 4 ICUs at a major medical center. They were interested in discordance, defined as at least a 20% difference between the physicians' and surrogates' expectations about a patient's prognosis.
In roughly half the cases, surrogates had substantially more optimistic expectations about prognosis compared to the physicians, and that the physicians' estimates were much more accurate than the surrogates.
The study appears in JAMA, Journal of the American Medical Association.
In almost all cases, surrogates misunderstood physicians' prognostic expectations. In about half of cases, surrogates held systematically different beliefs about the prognosis compared to what they heard from the physicians.
Those beliefs most commonly included the need to maintain hope in order to improve the patient's outcome, religious beliefs, and a belief that the patient had unique strengths unknown to the physician that would make the prognosis better.
Sometimes clinicians think that all they need to do is to communicate clearly about the patient's prognosis. They may need to explore family members and surrogates' beliefs about prognosis rather than merely conceptualizing their role as conveying the information clearly.
Knowing what I know now, I think I would have asked to just have an honest conversation. This is what I'm feeling, and how does that square with what your understanding is as a medical team?
Catherine Dolph, TheJAMAReport.